Hi everyone, my name is Cayla and I'm here today with Hannah. And today is our fourth session for our public health community outreach. And today we just wanted to start recording because we're hoping to launch our official YouTube channel in order to make our resources and videos more accessible to the general public. And if anybody is not comfortable with this, please let us know. We won't have any other people's faces or names on this video because we do want to respect your privacy. And we will be addressing any questions at the end after our recording, in which we'll have an open discussion and start our project. So today we'll be focusing on concussions and public health, more specifically heads up and how the CDC combats concussions.
Okay, so starting off, we're just going to briefly discuss what exactly a concussion is, even though most of you guys probably are familiar with the term from school sports, etc. So concussion is just a traumatic brain injury or a type of traumatic brain injury in which a blow to the head causes the brain to be bounced around and twisted in the skull. And then in the GIF on the side, we kind of show a funny image of what it's kind of like inside the brain. And the effect is that there's chemical changes and damage that happens to the brain.
So concussions are actually very serious, even though as a student athlete myself, I know that a lot of my friends think that just because it's common, it's not really something to worry about. Even though they're not life-threatening, they definitely have very severe repercussions. And in particular, repeated concussions can have really chronic and long-lasting consequences. So some potential serious effects of concussion include impaired brain development, increased susceptibility to other brain injuries and even more concussions, which can leave you even more damaged and hurt, and chronic issues with concentration, memory, headaches, balance, mood changes, and more.
Okay, so we're just going to briefly discuss some data behind student athlete concussions. So the 2017 Youth Risk Behavior Survey tells us some of these interesting statistics that we wanted to share. So 15.1% of students reported having at least one concussion related to their sports or physical activity, which is actually a surprisingly high statistic that even I didn't think would be true. And then 6% reported having two or more concussions. This kind of just shows what an important issue this is, even though we might not think that it is. And playing on more than one sports team increases the risk for concussions as well. So we can see that 16.7% of students who played on only one sports team reported at least one concussion, while 22.9% of those who played on two reported at least one, and then 30.3% played on three or more and reported them.
So concussions are especially common in student athletes, as you can see with those statistics we just showed you. And definitely we want to highlight this because a lot of our audience tonight and in our recent sessions have been youth. We've been mainly targeting the youth in our community as we hope to share this information in a more accessible and easily understandable way. And therefore, it is important to have protective measures that actually reduce the number of student athlete concussions, which we'll be going over next.
Okay, so here are some public health interventions that can help in educating people on concussions and possibly even preventing it from happening. So the first and probably most important thing is education. So educating coaches, parents, athletes, etc., on the dangers of concussion and how to recognize a concussion is probably key to learning how to deal with one and prevention of them. So Kayla's going to briefly discuss CDC's own initiative, which is called Heads Up.
Yeah, so the CDC's Head Up is actually a educational initiative series, which includes online resources such as videos, training modules, and websites and articles. And initially, this was really targeted at healthcare professionals in order to educate them on how to diagnose and manage concussions. But recently, we've found that these initiatives are actually better served towards educating the public, such as schools, your common teachers or coaches or parents, or even athletes themselves, because they're really the people who can prevent the concussion from happening in the first place and are the people who are there to first face it. In
So
addition, we also encourage the public to wear better designed safety equipment, such as helmets when biking, playing football, etc., that are concussion proof. And as you can see in the left here is the Guardian, which is a cap that attaches to the outside of the helmet with extra padding that can really reduce the intensity of helmet impacts.
sorry, I just wanted to add that later when we post this presentation on our classroom, you guys can click the link and look through the online resources and training that the CDC offers. So then we want to discuss creating a potential action plan. So there are certain action steps that can be used to combat concussions, and this is based on recommendations by the International Concussion Consensus Statement. So the first step is what we just discussed, which is educating coaches, parents, and athletes. Second is to make sure to remove athletes from play once they get a potential concussion. The third is to obtain permission to return to play, which means that they need to seek permission from a healthcare professional, as well as at least 24 hours of recovery. So, concussion emergency medical action plan is another important thing to discuss because it's important to know the contact information for emergency responders near you, as well as locations for trauma centers near you, etc.
So some other CDC recommended strategies include limiting contact during sports to what is appropriate, banning dangerous techniques and actions. I know that in particular in gymnastics, a lot of skills have been banned because of their causing a lot of head injuries. Checking sports equipment regularly and also maintaining it to prevent any accidents or malfunctions. Tracking the number of concussions in your school or in your team or area. This is especially important because they can really identify areas that are in need of concussion interventions. Sharing information and hosting or requiring training amongst the public. Creating concussion management teams and creating support systems for students in school who are recovering from concussions.
Okay, so continuing, there's also policy and rule changes as well as enforcement in sports that really help combating concussions. So some of these examples are zero tolerance policies for head contact in close contact sports. And for example, this includes hockey, which can become especially violent, and that's why they wear helmets, etc. And there's also banning and limiting of dangerous drills and techniques. There's the enforcement of supervision when there's potential for injuries in sports, as well as training requirements for coaches, athletes, professionals, etc.
So we want to highlight this particular law because of its importance to concussions. It's called the Zachary Listes or Return to Play Law. And this was actually first enacted in May 2009 by the governor of Washington at that time, Christine Gregoire, who signed this law, which was the firmest return to play law in the nation at the time. And this prohibited young athletes suspected of concussions or diagnosed with concussions from returning to play or the game without approval of a licensed healthcare provider. And in addition, this also applies to private nonprofit sports organizations. As long as they're using a playfield owned by a public, they must follow this law. And currently, all 50 states have the return to play law, which is an amazing progress that we made.
So we finally want to discuss the disparity that remains in public health. And for those of you who maybe want to go into public health in the future or are just interested to listen to these, I think disparities is one of the biggest things and should be, or public health professionals are trying to combat them currently. So first, not all states have passed laws that address youth who are concussed outside of playing sports, which may happen. And few states have laws that include provision of post-concussion return to learning during their concussion recovery. And this is especially important because academic accommodations should be made during concussion recovery because it will help youth be able to return to real life more smoothly, as well as mitigate the concussion side effects that they might face. Finally, American Indians and Alaska Natives have the highest rate of TBI-related hospitalization and deaths. And even though concussions is only a smaller or part of TBI, we still thought this is an important statistic to include. So factors that might contribute to this are higher rates of motor vehicle crashes, substance use, and suicide, as well as healthcare inaccessibility.
Okay, so next we wanted to put out a question for you guys, and you can just respond to this in the chat, and we can further discuss it after we finish recording. So yeah, I'm just watching the questions roll in. Okay, so one of our first questions that we can respond to is just Rachel's answer about how she can just talk about this with her friends and teachers and coaches. And I definitely think that starting a conversation is always a good way to spread awareness and to get started on this. You can always also refer them to CDC's own Heads Up campaign website and resources. We'll put the link in the chat. Okay, and then I also see that Vihan has an idea about setting up a school-wide initiative to have teachers and coaches receive concussion training. And there are also resources on the CDC's website as well for this, which you can access after. Okay, and let's just talk about one more for now. I see that Jason recommended creating flyers and posters for his school and community. This is a really great idea because graphics are a really easy and accessible way to kind of share and disseminate information. And there are actually people in the CDC whose jobs are to literally just create graphics, videos, and educational materials because it's so important to convey information really concisely and easily understandably. And they even have some talented artists. So you can really see how diverse the CDC is and how diverse this process of promoting public health is. And that actually brings us to our next activity.
Okay, so thank you guys all for staying with us today, and hopefully you guys learned something. We're gonna stop the recording now, but we hope that you guys are able to enjoy, and then we will be doing this as a group activity together. Thank you guys. We'll see you next time.